to everyone. A popular actor, Mr. Naveen Chandra, and our clinical team around Dr. Fani, Dr. Shashi, Dr. Emmanuel, Mr. Akbar Industry, and one more my friend who is not here today, Mr. Vijay, Dr. Ramanan, and of course the entire media. Thank you all very much for gathering here today. It's not new for most of you, especially the media, who has been every month at least minimum once they are witnessing the kind of medical miracles this institution been doing. If you talk about spine alone, there are a lot of myths and misconceptions. It is still there, still very much prevailing among the general community, of course. Unfortunately, because once you get operated, you are going to be paralyzed, your quality of life is compromised. And of course, these kind of myths and misconceptions are still prevailing among the general community and of course the educated community. That's where the idea was born. What is this spine surgery? How difficult it is and how this can be promoted widely. The journey started about 5 years ago, where we were literally struggling because one should get to know who is experiencing the pain related to spine. Because I myself is the standing living example. I know what kind of trauma the individual can go and how the quality of life can be compromised. All these things really one who is experiencing only will be able to explain and tell. That's where the discussion, the idea was born. Then fortunately our clinical team always takes the leadership role in these kind of medical miracles or medical inventions. So we experimented. Initially there was a massive response because people suffering with severe pain, getting into the OT and coming back by walking on their own. It's a miraculous moment we have seen. And this number is not a number alone. 500 plus people giving back a quality of a normal life that gives enormous, tremendous job satisfaction for us. So that was the main intent of having these kind of awareness sessions, orientation sessions, because still, because of the sedentary life, mechanical life, people are, if you take the Chennai population alone or even the country's population alone, I am sure that Fani also can join my voice. Every family, you see minimum one person is struggling or suffering with spine problem. Every family. But doesn't mean that each family member should undergo a surgery. Fortunately, most of the spine problems can be managed conservatively by taking certain precautions. Again, I am the living example. I am a 15 years old patient of severe L5S1. Still my life has not compromised, my quality has not compromised. Still I am leading a normal life. I play badminton every day 1.5 hours. I do every exercise. Nothing compromised. But it's not happening, it's not so to most of the population here. Quality of life, day to day their life is compromised. That's where the biggest challenge. That's why there are solutions equally. Surgical solutions, wherein it's most of a daycare. It's not a like a regular operation, normally we call it as it's a daycare surgery. Patients should be there. And we don't even call them as patients. They should be there for a few hours and they can go back and start their normal work. So this is how the medical miracles, especially this unit, is producing month on month. And thanks to the entire media, of course, the celebrities like today we have Mr. Naveen, and past we had many celebrities who are acknowledging, endorsing these kind of medical miracles. That gives us some motivation.
The information and awareness amongst the public, which is for better social welfare and good for a lot of people who are suffering, but they don't know the availability of such treatment options. The main idea of this event is to spread the awareness and to stop or remove all the unknown fears. There is a lot of fear and misconceptions which keep patients from seeing. On presentation, I will just briefly let you know what is an endoscopic spine surgery. It is just basically a keyhole procedure which is done to release the compression on the nerves in the lumbar spine. So, lumbar disc prolapse is a very common problem. A lot of people would have heard about it, seen patients suffering. So, disc itself is a structure in between the vertebrae, and it undergoes age-related wear and tear, which is natural. Everybody has some disc-related changes. When you do an MRI, you will see some changes on the MRI. So, most of them are natural age-related changes, which are normal for age. But sometimes these discs can prolapse a little too much, start pressing on the nerves and cause problems. When there is compression on the nerves, then patient starts having the pain going down the legs. If the nerve compression is severe, it can cause numbness, weakness, inability to walk, and that restricts their lifestyle and activities. So, when there is a lumbar disc prolapse, it is not that everybody, all of them need a surgery. 90%, more than 90% of them we treat without surgery. It is those 10% who have more severe problems, more prolonged symptoms, or severe neurological deficit, weakness, numbness. Those are the ones who need surgery. And surgery has been, it has evolved over the years. Now this is just a MRI to show you that this is the lumbar spine. You see the vertebrae, and in between the vertebrae there is a disc at each level, and there are nerves inside the canal. Now if you see this disc is bulging quite a bit into the canal, this one also. The space for the nerves that was adequate here has become very narrow here and here. So this is just this is the cross section of the same levels where you can see the disc fragment inside the canal here, and this bulging into the canal and pressing on the nerves. But as I said, even if there is a very large disc on the MRI, doesn't mean it needs a surgery. We always decide based on the symptoms, how long the patient has been suffering, what is the neurological deficit. So these are the factors we consider. What is the functional disability? Are they able to walk and do their work or not? Is the pain limiting their activities, ability to work? So these are the factors we take into consideration before deciding whether surgery is required or not. And also how long it's been there, whether we have tried other treatments and failed. Most of them improve. 90% of them do not need surgery. But those who need surgery, this lumbar disc surgery has also undergone over the years. If you see, this was when I was an orthopedic PG in 2003. This is how 15 centimeters open surgery for a single level discectomy was the usual. The patient would be in the hospital for 1 week, 10 days. They will take a lot of medications for pain control, and then it takes time for them to start walking again. So this, and then there was this micro discectomy, which is a much smaller surgery with the use of microscope and different retractor techniques. We could minimize the amount of muscle damage that we do to reach the disc. And this has become the gold standard for many decades, like last 40, 50 years, micro discectomy is the gold standard. But then technology always keeps changing. There's always new advancements, things to improve and make things easier and better for us as well as for the patient's safety. So this endoscopic technique has made it possible to achieve the same amount of decompression through a much smaller incision. It is not about the length of skin incision, it is the amount of damage that happens to the muscles inside. When we try to reach the spine, we have to cut through the muscles and reach there. So that leaves some scarring, and that does cause some long-term symptoms. So we have to minimize the muscle damage but also achieve the same target surgery with very minimum surgical insult. That is the aim. So this endoscopic technology has evolved over the last couple of decades. It's been there in Western countries, in Japan, Korea, for over 20 years now. In India, probably in the last 10 years it has come here. We did take it up very early. We are one of the early, and so this is the endoscope. This is a 8 millimeter diameter scope which has a 4.1 millimeter working channel through which instruments are inserted. There is a camera. There is a channel for irrigation, saline irrigation, and this is how we see it. There are some different scopes, different sizes depending on whatever pathologies we use there. And this is just a cross section. You see, this is the spine, this is the disc, these are the nerves in the spinal canal. This is the endoscope going in, and the endoscope allows us to see what we are doing inside. In 2015, this was the first endoscopic transforaminal under local anesthesia that I did in global, and it's always any surgery, any technique, all these achievements, about 500, 600 surgeries, it is not just one person, it's a team always. No single person can achieve all this. It's all the colleagues, the anesthesia team, the OT staff, everybody who takes care of the patient, the nursing staff, all together come together and achieve this. So this was the first in 2015, and then on we have been doing more and more. These kind of keyhole surgeries are done, can be done under local anesthesia. Those who are unfit for general anesthesia, it is a big benefit. There are people with old age, diabetes, hypertension, heart problems, liver failures. So a lot of these people with medical conditions are at a high risk if we give them general anesthesia. But then they have this problem which is troubling them, and they sometimes need surgery. So the surgery can be done under local anesthesia, which is a major advantage, where we can avoid general anesthesia, that can reduce the risk to their lives. So we see it on the X-ray, where the channel is going through a guide wire, and then the endoscope is inserted, and we see it on the screen. It's a large magnified view of inside the spine. So that makes it very safe. There is continuous irrigation of fluid, so there is no blood loss. There is hardly any single 1 or 2 drops of blood loss in this kind of procedures. And the field is very clear, as you can see the nerve, everything is clearly seen. So that is another approach where we do through the midline. This is under general anesthesia. So just a small video of any compression. That is the end point of surgery, and that's it. That is what we do. We just go to the spine where the problem is through a very narrow scope and remove the problem. Procedures has much less muscle damage, much less pain. Post-surgery, the patient walks within a few hours. The moment their anesthesia and sedation effects are gone, they start walking. They are relieved of the previous pain, so they walk with much less pain than before. Actually, the surgery pain is quite negligible, and so they need less medication post-op. There is no need to give them strong medicines for pain control, and the hospital stay is short. Within a day, next day they go home. Almost all of our disc surgery patients have gone home the next day, and they all can get back to their work much faster. So if it's a sitting job, not much of travel involved, so within a week or two they can start working. So that is the advantage of these kind of minimal invasive surgeries, and it is very safe. The main misconception is that we will see in some patients giving the testimonials also. There is a widespread view that spine surgery is dangerous and risky, and after spine surgery the people will become paralyzed, they will be bedridden, they will not walk, they can't work. So these are all widespread misconceptions. Every day when I talk to the patients, this is what I have to be reinforce and explain and give them the confidence that that is not the reality. And technology also helps us to make things very, very safe. So, and it is not that this has drastically increased the cost. Also, it is almost the same as the conventional surgeries that were being done before. So that is the gist of it. The aim of idea of this event is basically to create awareness about the availability of safe spine surgery. And endoscopic spine surgery is one of the most minimal and spine surgeries for a most common spinal problem which very often needs surgery. So I thank you all, and I request you all to listen to the patients, what their feedback is, and help us spread this information to the general people, and especially to those who might be suffering with these problems. All these patients who have had surgery, some of them have been struggling with the problem for 3 years, 4 years, tried a lot of treatments, but because of fear of surgery, they were continuing to struggle because other people tell them something, so they get scared. I would always say, you take the opinion of the experts, understand the problem, and what is the risk involved. Find out what is the risk involved. You discuss with the experts, they will tell you, this is a problem, this is a procedure, these are the risks. We always explain our patients everything. And then they take a decision whether to go ahead with it or not. Once they understand the problem and listen to the risks involved, then it becomes easier to make a decision. So I want the help of our media friends to help us spread this information. Thank you.
என்னுடைய பெயர் ஜெசிதா பெர்னாண்டோ. எனக்கு 72 வயதாகுது. 2022 ஸ்பைன் முதுகில் ஒரே வலி, நடக்க முடியாது, பெண்ட் பண்ணிட்டு தான் இருப்பேன். டாக்டர் பணிக்கரன் தான் வந்து கேட்டதுக்கு அவங்க சொன்னாங்க, இந்த நரம்பு பாதிச்சிருக்குமா உங்களுக்கு அப்படின்னாங்க. காலும் நடக்க முடியல, லெஃப்ட் கால் நடக்க முடியாது, ஃபுல் பெண்டு, என்னால் நிற்கவும் முடியாது, அவ்வளோ கஷ்டப்பட்டேன். ஃபெப்ரவரியில் வந்து ட்ரீட்மெண்ட் ஸ்டார்ட் ஆச்சு. மே மாதம் எனக்கு ஸ்பைனல் ஆப்ரேஷன் பண்ணாங்க. 1 மந்தில் 3 மாதம் டைம் கொடுத்தாங்க. 1 மந்தில் நான் நடந்துட்டேன். ஃபஸ்ட்டு நான் ஆப்ரேஷனுக்கு வரும்போது எங்கள் காம்பவுண்டில் எல்லாருமே என்னை பயங்காட்டினாங்க. 72 வயசு ஆயிடுச்சு ஆண்டி, நீங்கள் ஆப்ரேஷன் பண்ணாதீங்க, பண்ணிங்கன்னா உங்களுக்கு கால் கை விழுந்துடும் அப்படின்னு ரொம்ப பயங்காட்டினாங்க. நான் கடவுள் மேலே பார்த்து போட்டு, ஆனால் பணிக்க எனக்கு ரொம்ப சப்போர்ட் பண்ணாங்க டாக்டர். அவங்க ஃபுல் சப்போர்ட்டு. இப்போ 1 இயராக நான் இப்போ நல்லா நடக்கிறேன், என் வேலையை நான் செஞ்சுக்கிறேன். அந்த 1 மந்த் நம்ம ரெஸ்ட் எடுத்துட்டோம்னா பயப்படவே வேண்டாம். நானே சொல்கிறேன், நான் எவ்வளோ பயந்தனோ அவ்வளோ இவ்வளோ தைரியமாக நான் பேசுகிறேன்னா சக்தி தான். நல்லா நடக்கிறேன், நல்லா வேலை செய்கிறேன். இன்னும் எதுவுமே எனக்கு செய்ய முடியாது, எல்லாமே சர்வெண்ட் தான் பண்ணாங்க. ஆனால் இப்போ நான் நல்லா இருக்கிறேன், எந்த மெடிசனும் இல்லை. தேங்க்யூப்பா.
IT company. I was, there was invite from Dr. Panikaran's office that, there's an event we are having, if you can make it, that would be nice. And I said, yes, I will definitely come. The issue, the experience I had, maybe like what Mr. Mosker that he said, I have the living example, like another example, right? Since 2008, I've been having a back pain for a very long time. I had many, kind of exercises, I've been, skipping it all those years. And last year, if I remember, sometime in October, I had a severe back pain and I could not move also. Then I have went to some hospital locally based on my friend's references. They gave some suggestions. That didn't solve, much. And basically, since my work is more of a setting and IT related, we skip a lot of such, kind of, a lot of those issues, right? Then, one fine day, I couldn't walk. My whole leg was frozen. Okay? And my wife was not in town. I had 3 children. And I don't know what to do. I was crying myself. Then, with the help of my friend, came to me. I had so many surgeries. I had here, so many, I can say. But you know what, when you say back, I really I was scared. And I have twin boys. They said, I want to see, Dr. Panikiran after my successful operation. Okay? And I'll tell you why. So I met Dr. Panikiran and immediately, because I was referred by Dr. Satish, who was a liver surgeon here, because he was my neighbor. And then luckily I got an immediate appointment, and I'm sure there's a very standard process they maintain in the hospital. And I met Dr. Panikiran, and he advised me to go for some MRI. Initially it was a scan, we couldn't see properly, then he said MRI. And then luckily I was able to get an MRI appointment. The next day he said, let's go for operation. The first day when I met him, he said, I won't do surgery unless it's really needed. Okay? But maybe the way you are looking at, full of pain and so on, I don't know, but I will do my best. So he said, we don't go for surgery. And I said, is there any other way? Because like anybody else, I also scared the back surgery. Then he said, no, I think that's the option. Then he also explained to me the endoscopic, right? I see some videos are here, right? Please listen. It's going to be very important for everybody. It's a very easy surgery, in my opinion. I think it took only maximum 1 or 2 weeks, I went back to work. I'm doing regular exercise now, walking, running. I have completed my 10K, run recently. So it's quite normal life for me now. Okay, and I am one of the global leaders. I think this hospital name also quite known now because I took 1 month leave. I resumed the work in 3 weeks' time. Okay, so all I'm saying, first of all, you should not worry about back surgery anymore. Okay, like Mr. Oscar said, 500 plus endoscopic surgery patients. It means the 500 of them got a normal life back, including me. Okay, it's not easy. I had some surgeries in my family. When you say back, I came from a village. So they say cut the back, right? They are all the sewers. They cut the back. They will remove everything, and that's it. Your life is gone, right? I think it's completely now. I mean, we have to, kind of erase that. People have to, have such more, event. People must come forward and seek advice, right? So I think, in my opinion, after I met Dr. Panikiran, I had a pain first 1 or 2 days. The way, if I still remember, I was in anesthesia, and after my operation got over, maybe I was in some 70%, kind of, I could sense what's going on. When the Panikiran came and touched my feet, there is a bigger finger, he was checking, whether, and he was doing some testing, whether the motor is running or not. I don't know what is motor, but I could sense how committed he is. Okay, I was so happy. Whenever I met him, I told him, my children want to see you. Okay, because they were scared on, my operation. They asked, they told me once, Appa, I want to see the doctor who, operated you. So, I'm so emotionally speaking here. Thanks for the opportunity here. And, I'm one of the, definitely passionate for this, such surgeries. Because I'm completely normal. No more pain. No more pain. Even there is no scar also in the back for me. It's completely normal. Right? As I said, I had at least 7 surgeries in my life. Some I had in Malaysia, I was in Singapore for some time, I was living in Mumbai for many years. There are many surgeries I had. The back surgery is the first time. Okay? So I think, if somebody comes to this hospital, and meeting Mr. Panikran for this surgery, I can tell you, they'll be alright. Right? Any questions anybody has, I will be happy to answer, or I will give it to others. Thank you so much.
Even the patients, the people who are coming from out, they've been celebrating the festival. So Bhaskar Garu told me every festival, இங்க வந்து எல்லா ஃபெஸ்டிவல் ரொம்ப நல்லா கொண்டாடுவாங்க. அந்த பேஷண்ட்ஸ் ஆனாலும் இங்கே இருக்கிற ஸ்டாஃப் ஆனாலும் எல்லாரும் நல்லா கொண்டாடுவாங்கன்னு சொன்னாங்க. So thank you sir, thank you for making them always joyful in the hospital. And good morning to all the noble community of humankind. Because you people are the saviors, you people are the guide of every individual in this country, every individual in this state, and every individual in this home. Because ஒரு சின்ன வலி வந்தாலும் நம்ம டாக்டர் கிட்ட போகிறோம், போன உடனே அவரோட அட்வைஸை கேட்குறோம், அவங்க சொல்கிறதில் நாங்கள் ஃபாலோ பண்ணுறோம், அவங்கள எங்கள் ஒரு ரோல் மாடலாக வச்சு நம்ம நிறைய விஷயத்த வந்து நிறைய பெயின், நிறைய வலி, நிறைய ஹெல்த் இஷ்யூஸ் வந்து அவங்கள ஃபாலோ பண்ணுறோம். ஏன்னா ஹாஸ்பிட்டல் போன உடனே போன ஒரு 1 ஹவருக்கு அவங்க கொடுத்த ப்ரிஸ்கிரிப்ஷன், அவங்க கொடுத்த ஐடியாஸ் இதெல்லாம் எடுத்துகிட்டு கொஞ்சம் ஒரு நாள் மறந்துடுவோம். ஒரு டேப்லெட்ஸ் போட்ட உடனே வலி கம்மியானாலும் மறந்துடுவோம். வி இக்னோர் மெனி திங்ஸ். பட் 500+ endoscopic spine treatment, it's not a joke, 500+. And it's going to be more, sir. And Panikumar sir, after seeing all the testimonies, like I'm really happy. There was a lot of joy, because pain is one thing which can be told, and pain is one thing which can be removed by only doctors and the surgeons and people from the hospital. So thank you for doing this to many people here. And இப்போவே லைக் அம்மா வந்து பேசினாங்க, ரொம்ப சந்தோஷமாக இருந்துச்சு. பிகாஸ் அந்த ஏஜில் வந்து you tend to lose a lot of confidence, you tend to lose a lot of thing, you support கிடைக்காது நிறைய பேர். But when the doctors give the support, this pain is nothing. You can just walk within a day. That gives more of strength and confidence. And hopefully, like, I'm fit now. I'm super fit. I'm taking care of my health well. Even in our film industry, there are a lot of stunt people. They break their spine by doing the stunts. அவங்களுக்கு தெரியாது where to go and reach. சர்ஜரினாலே பயந்துருவாங்க. சர்ஜரினாலே they get scared, saying that no, அது பண்ணால் பிளட்டு நிறையா போயிடும், அது பண்ணால் மாத கணக்காக வீட்டிலே இருக்கணும், ஒர்க் போக முடியாதுன்னு சொல்லுவாங்க. பட் திஸ் சர்ஜரி ஐ கேரண்டி யூ, பிகாஸ் பாஸ்கர் கார்கிட்ட நான் ஃபஸ்ட்டு வந்து மீட் பண்ணும்போது அவர் சொன்னார் இந்த சர்ஜரி பற்றி. ஃபார் ஷோர் திஸ் சர்ஜரி வில் மேக் யூ கைஸ் லைக் வாக் அவே ஃப்ரம் ஹாஸ்பிட்டல் வித்தின் அ டே. That's a miracle. Thank you for the global hospital here, and especially the staff who has achieved all this. And I will spread a word for sure through my social media and through all my accounts. I'm going to spread this word so that நிறைய பேருக்கு அவேர்னஸ் இல்லை. இப்போ சர்ஜரினால எல்லோரும் பயந்துடுறாங்க. இப்போ எனக்கும் ஏசிஎல் டேர் இருக்குது, ஆக்ஷன் மூவிஸில் பண்ணும்போது நீ டேர் ஆகிருக்கு. பட் அந்த டைமில் when it got teared, நிறைய பேர் வந்து சர்ஜரி பண்ணணும்னு சொன்னாங்க. சர்ஜரி என்னாவே நோ, some third party tool is coming in your body, that means it will pain a lot to you and you will not be in a normal life. But since I have seen these testimonies here, and they are very normal in their life, within a day, within a month, normal life ஆகுது. It's all your hands, and it's your miracle தான் இது. And thank you for doing something like this, and for sure I am going to spread this word. ஆர்த்தோபெடிக் ஆனாவே லைக் நிறைய பேருக்கு ஒரு கன்சர்ன் இருக்கும், என்னடா இவ்வளோ டெஸ்ட் இருக்குமா, இவ்வளோ சர்ஜரி பண்ணால் லைஃப் இஸ் நாட் ஈஸின்னு நினைப்பாங்க. பட் நவ் த டெக்னாலஜி ஹேஸ் க்ரோன், and Bhaskar Garu told me that robotic technology has come out here, and it's more accurate, it's more accuracies, it's more, and it's treated within a minutes, and everything is fed by the doctor himself. Like that was great, sir. And the time which I spent, and I belong to a film industry, action, love, all these things are going in my life. நிறைய பேருக்கு என்ன தெரியாது, பட் தெரிஞ்சவங்களுக்கு தேங்க்யூ. தெரியாதவங்களுக்கு நாங்கள் ஒர்க் இன் தெலுங்கு ஃபிலிம்ஸ் அண்ட் தமிழ் ஃபிலிம்ஸ். இப்போ ரீசெண்டாக ரிலீஸ் ஆக போகுது நிறைய தமிழ் ஃபிலிம்ஸ். ஸோ அவர் கொடுத்த அவேர்னஸ்னால ஐ எம் கோன் ப்ரமோட் திஸ் endoscopic spine surgery in my film industry, at the same time in my state, Hyderabad. Telangana and Tamil Nadu. I'm going to spread this word through my all social media platforms. And thank you guys, thank you for giving confidence for a normal public that you come to our hospital, we give you our best surgery. And this is an example, 500 plus endoscopic surgery. And it's a miracle, sir. I congratulate each and everyone from this hospital. God give you more power to do all this. And my prayers for each and every staff of this global hospital to give them strength, to give them patience to deal with patients, because we come here with pain and you relieve us from the pain. So that's equal to a God. So God give you more power, be strong, be encourageful, get encouraged and support us. We are just a normal public, you are gods for us. So thank you Global Hospital for inviting me here, because I nowhere belong to this field. If anything happens to my family, weekly hospital go. But thank you Akbar sir, my producer. We shot a film here. One day I shoot panno. The staff were good. People are good around here. The atmosphere is very healthy here. So I'm happy to be invited here, and I could see all you people like having a good vibes here. So all the best for your future. Please take care of the public, please take care of us, please take care of everyone, and God power to you. Thank you so much for inviting me. Thank you.
May I invite Mrs. Jacinta and Mr. Kumar to come up on both the patients who have shared their experience. We are most happy to welcome you on the stage, sir. Mr. Nixon and Mrs. Jacinta to come up on the stage, please. To join for a group photo. All of us together, please.
All the participants and students here to spread this awareness and give this message and talk about endoscopic spine surgery and safe spine surgery to all the people. Thank you everyone. Thank you.
Dr. Sashidharan, non-consultant spine surgery.
Spine surgery team at Gleneagles Global Health City, Chennai. In the endoscopic spine surgery, minimally invasive spine surgery, ஒரு ஆப்ஷன் இருக்கு, ஒரு சேஃப் சர்ஜிக்கல் ஆப்ஷன் இருக்கு. இந்த மாதிரி லம்பர் டிஸ்க் ப்ராப்ளம்ஸ்னால சஃபர் ஆகிட்டு கீஹோல் சர்ஜரி மூலமாக ட்ரீட்மெண்ட் ஆப்ஷன் அவைலபிளாக இருக்குன்னு ஒரு அவேர்னஸ் கிரியேட் பண்ணுறதுக்கு தான் இந்த ஈவெண்ட் பண்ணோம். லாஸ்ட் 8 years we were just going through our records, how many endoscopic surgeries we have done. So I have been here in this hospital for last 12 years and have started doing these endoscopic spine surgeries from the year 2014-15. Over the last 8 years we have seen that endoscopic spine surgeries in Pandadu vandu 578 which I thought it's a considerable huge number. Not many centers in India would have done so many, at least not in Chennai. So I thought this is an occasion for us to give confidence to the people who are scared of surgery, spine surgery especially. There are lots of misconceptions. Like we saw our patient testimonials, they were all scared and suffering for years before they finally went through the procedure. So andamari நிறைய பேர் ப்ராப்ளம்ஸ் நல்லா சஃபர் ஆகிட்டே இருப்பாங்க பிகாஸ் ஆஃப் த ஃபியர். பயம், சர்ஜரி பண்ணால் ப்ராப்ளம்ஸ் வரும், பேரலைஸ் ஆகிடும், நடக்க முடியாமல் போயிடும், இந்த மாதிரி மிஸ்கன்செப்ஷன்ஸ் எல்லாம் இருக்குது. ஸோ வாட் ஐ வாண்ட் டு சே இஸ், இந்த மாதிரி லம்பர் டிஸ்க் சர்ஜரிஸில் ரிஸ்க் ஆஃப் பேரலிசிஸ், நடக்க முடியாமல் போகிறது, அது எல்லாமே வந்து லெஸ் தென், இட்ஸ் வெரி 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 எக்ஸ்ட்ரீம்லி ரேர் பாசிபிலிட்டி, less than 1% ன்னு சொல்லலாம். And we have in all these 578 surgeries, none of them had this kind of major problem. Of course, any surgery will have some minor complications which are all treatable. Okay, so like all of them, we have seen our complication rate also, recurrence rates or infection rates, all are less than 1%. So all the patients that have undergone this endoscopic spine surgery are all right. Even if those who have had complications, they have been treated later on and they have recovered. So the main aim on the just basically to reduce and remove all the misconceptions and unknown fear about complications about spine surgery. Second thing is, the endoscopic spine surgery has many advantages, like we saw. It is minimally invasive, hospital stay is very less, recovery is fast, they can get back to their work much faster. So, and there is no major scar, muscle damage is less. So this enables them to go back to their lives much earlier, much faster than a conventional open surgery. That is the main advantage. And for as a surgeon, for us, it makes the visualization clear. Everything is we can see in a magnified screen very clearly. So that makes it safer also. When you see things clearly, the chances of problems happening is much less, because we see the nerves, we see that everything is clear. The clarity is much better. That technology gives us that advantage in these endoscopic procedures. So that is what I would like to convey.
இதில் ஸ்பைன் சர்ஜரி வந்து டிஸ்க் டேமேஜ் ஆனாலும் அதுக்கு கரெக்ட் பண்ணுவீங்க.